I'm Peggy Peck, reporting from the American Society of Clinical Oncology meeting in Chicago. Testicular cancer is the most common solid tumor diagnosed in men between the ages of 15 and 35, and research reported at the plenary at ASCO suggests that a treatment, a single dose of carboplatin, may be an effective therapy for about half of those cancers. Here, Dr. Timothy Oliver describes the study.
So this trial, which I'm going to be presenting, is the largest trial that's ever been done in testis cancer, which is, of course, a relatively rare cancer, though it is still the most frequent cancer in men between the ages of 15 and 45. And the rationale behind this was that the stage 1 seminoma is the most common presentation of testis cancer today, about 40%. Radiation has been for nearly 60 years the sort of standard of care, involving radiating sort of all the way down the front of the abdomen and the pelvis. But with that radiation, as we've followed it more carefully and we've had better tools for following up, we've become aware that patients have been dying in excess of that expected for men of the same age without testis cancer being irradiated. Now, of course, it turns out that at least half of those excess mortality is not due to radiation-induced cancers, but there have been increases in cardiac and cerebrovascular disease. And even the cancers that occur, about a third to a half of them, don't actually occur in the radiation field. So it's not just the effect of a specific radiation, but it has demonstrated a need for alternative approaches, of which reducing the radiation dose has been one exploration, but developing treatments where you survey the patients and watch them very carefully has been the other. Now that's been reasonably successful, but there is a much higher relapse rate of against the 5% with radiation, between 15 to 20%. But more importantly, it opens up a relapse that is occurring very late and very rarely can even cause paralysis. And that's one of the reasons that people have been less favourably inclined to do surveillance in these patients. Now, 30 years ago, I first treated a patient with seminoma as a naive young doctor, and he persuaded me to break the protocol and refused to lose his hair. And as a consequence, this trial has now came into being because we discovered that seminomas are far more sensitive to platinum drugs than the non-seminomas, which is the more frequently investigated testis cancer. And 15 years later, we were actually then able to show that we could just use one dose, a single dose, given over a sort of 2-hour infusion in outpatients without any major side effects, and go home and they can go back to work on the following 2 or 3 days later. And this clearly seemed to be a better approach, and it seems to be equivalent in those pilot studies. And so that was when in 1996 the MRC set up this randomized trial. Now, the background to the design of the trial, because the radiotherapy was also under investigation and trying to reduce dose, we had a slightly complex process to randomization where 3 patients were allocated to the carboplatin experimental treatment versus 5 to the radiation. This enabled them to carry on randomizing for 2 different doses of radiation, 20 gray and 30 gray, that they had studied. And so we had this enormous and rapid recruitment of this trial, because it was very much interested people all throughout the world. It was in 70 centres in 14 countries. And we recruited in 5 years 1,477 patients, and the aim was to recruit more than 1,200, and in order to show in a non-inferiority way that the carboplatin was a safe alternative. And the primary outcome we measured was how many relapses, or the relapse-free survival. And the median follow-up now is 6.5 years. Now, the total relapses are almost equivalent in the arm, 5% in carboplatin, 4% in the radiotherapy. And in fact, some of the patients, due to slight problem with the way the protocol was written. Didn't get the total of full dose, and when they corrected those, the actual relapse rate was 4% in those that got the full dose. So we've fairly solidly confirmed our primary endpoint, which is that carboplatin is an alternative and equivalent management strategy for these patients. But we found something quite unexpected, was that there was this 78% reduction. That was a hazard ratio of 0.22, with a p-value of 0.03, in the numbers of tumours in the other testis. Now, tumours in the other testis are like the breast cancers in the other breasts. As you know, tamoxifen is, if you give tamoxifen to breast cancer ladies, at 5 years, you get probably about 50 to 60% reduction of contralateral breast cancers. In this extraordinary tumour type, here was one single shot of chemotherapy producing a 78% reduction at 5 years in this condition. However, I do add the rider that as we've noted in 2004, before we can demonstrate unequivocally the safety of these things, we will have to keep following these patients for at least 20 years. Thank you very much.
So to sum up, a single dose of carboplatin, as effective as radiation therapy, but with an added advantage, a significant 78% reduction in contralateral tumors. At ASCO in Chicago, I'm Peggy Peck, MedPage Today.